There are controversial new medical guidelines out this morning aimed at every man in America. A government panel says men should not have routine PSA screening tests for prostate cancer.
This disease is the second leading cause of cancer deaths in the United States. It kills 33,000 men a year. With us in Studio 57, Dr. Otis Brawley, Chief Medical Officer of the American Cancer Society. With us is former Notre Dame basketball coach and prostate cancer survivor, Digger Phelps. I'm pleased to have both of them here this morning. So what are you saying?
Well, I don't speak for the task force, but what the task force actually said was that when they look at prostate cancer screening in the population, there are actually more men harmed than helped by this test.
Harmed how?
Unfortunately, a number of men who are identified as having prostate cancer actually have a disease that actually is cancer, but it doesn't need to be treated and cured. Many of those men are treated. The treatment actually can cause heart attacks, it can cause blood clots, it can cause death. A number of bad things can happen when you start getting medical interventions that you don't need.
Digger Phelps, what do you say?
Well, I'd say personally, my experience, April 28th, 2 years ago, I found out I had prostate cancer. And what I did was go out to the University of Seattle and the Hutchinson Cancer Research Center and looked at all the options and decided to do the robot surgery. But Charlie, from April 28th to June 8th, the fear of the unknown was a living hell for me. Once the surgery was done, and Dr. Ellis and Dr. Wright said, we took care of it, it's out. This was on June 8th, 2 years ago. Then June 11th, I got the biopsy report back. I didn't know this, but every capsule in our body has 4 layers. My cancer was in my 3rd layer, ready to come out the 4th. They say that they got it out and they checked 15 lymph nodes. Now, I started doing physicals twice a year when I turned 60. So this was from back in October to April. My PSA jumped up from about 2 to 3.44. That took what? The PSA is a blood test with all the other tests they do with a physical. The second part of it was this. The physical part took 15 seconds, and the tenderness was there. That's when I knew there was an issue. But the point is this. When I survived that, knowing that it was like, if I waited from October to October, that cancer could have come out of that layer and spread. And that's the concern I have. The second part of this is the cancer awareness, especially prostate cancer awareness. Charlie, women are all over this. 1 out of 8 women get breast cancer. You see Pink everywhere doing many events during the year. 1 out of 6 men get prostate cancer. And I've said on the 6th of every month we should be wearing blue. And if you go back to this past college basketball season, the black men in this country coaching, the African Americans, the last week of February when they found out the awareness, 1 out of 5 African Americans get prostate cancer. So what did you see in college basketball the last month, the last week of the season, that month of February? Every coach wearing a blue tie for the awareness. So as far as I'm concerned, this information, men are macho. They don't want to hear about, oh, I got to get a test. Now I think we're taking a step backward, and you're going to see more guys putting off the awareness of check yourself out. And that's what bothers me about this.
Dr. Brawley, he brings up the point, too, about men being macho. We hear often it's hard enough to get a man to the doctor. Are you concerned at all that this will keep men even from going for a regular checkup?
I'm more concerned that what we've been doing in prostate cancer with our awareness is actually giving men a reason not to trust us in medicine. This is a test that actually leads to a series of medical interventions that could actually kill more Americans than help more Americans. Now, what the task force is against is routine screening. What I would prefer to see is what I'll call selective screening within the physician-patient relationship. We need to tell men the potential risks, we need to tell men the potential benefits, and let them make their own decision. We need to not dupe men into thinking that there's always benefit with this and everyone's going to get help, because some people are going to get killed because they get the test.
So then do you disagree with Digger Phelps' approach about awareness?
I think the awareness has gone a little overboard. I'm pro-awareness, but I think we need to be smart about it. I think we need to actually tell men that there are risks to this test. There are scientifically known risks. Indeed, scientifically, the risks are better proven than the benefits right now.
Digger Phelps is shaking his head. Digger?
I just think there's nothing wrong with the test. You do a blood physical for all blood work. It doesn't matter if it's your cholesterol, doesn't matter if it's your sugar, and yeah, you throw in a PSA. The physical takes 15 seconds when you take a look at what's going on with these men doing it. Now you're backing men away who completely say, oh, I don't need to do this. I disagree because I'm a survivor. Tubby Smith, from Minnesota had it last summer, took care of it. Jim Boeheim from Syracuse. Jim Calhoun from Connecticut. We as coaches are role models to say, listen, man, step up to the plate, take a swing. You can decide if you want to swing or not swing, but at least get the exam and let you and your doctor decide.
Okay, but
this is what I'm concerned about, because now men who are macho, they're going to go backwards on this altogether, and you're not going to see men doing any testing.
Okay. I mean, you're worried about doctors will not, men who might have the risk of prostate cancer not going to see their doctor because they don't think a test is necessary. But it seems you two agree on this one point. You ought to talk about this with your doctor as to whether you need a test or not. Right?
I
think, Charlie, my own situation, the doctor saved me. The doctor, if I waited till November, that cancer would have gone through that fourth layer and then get in my lymph nodes. Hey, who knows once it breaks through where it goes in your body? That's a concern I have for men. I took care of mine, got rid of it. I don't want to worry about the prostate anymore.
I think given what we know scientifically, there are some men who will find out what we know and decide they don't want to get screened. I think those men should be respected. There's some men who will want to get screened. I think those men should be respected. And I do want people to realize at this point, the harms of this test to the population as a whole are better proven than the benefits. We actually may very well be killing more men than lives saved.
The bottom line here is people ought to look into this.
Do you have information, stats on that? Are there stats on that, Charlie?
We're out of time, Digger. This obviously, because of what has transpired in this conversation, merits more attention, and people who have questions to go do some research and consultation with their physician.
Dr. Brawley, Digger Phelps, appreciate both of you and your time this morning.